Hello, and welcome to the Ascension St. John Bariatric Video Seminar. I'm Dr. Ty Kirkpatrick, a minimally invasive trained surgeon as well as bariatric fellowship trained surgeon, and proudly serve as the medical director here for Ascension St. John Bariatric Program. I'm excited to explain all the benefits of bariatric surgery to you, and we'll go over all the nuances of our bariatric program as well. I am a native Oklahoman and proudly serve my community here in Tulsa. That is where my office is located. We also have a bariatric surgeon in Bartlesville, Oklahoma, Dr. Brent Stewart, who proudly serves this community there, who's been performing bariatric surgery for a long time. So here at Ascension St. John, I was very proud to offer our services here to the community. And we have an outstanding program that is all-encompassing, all centered around the bariatric patient. We are going to get into the details of bariatric surgery here shortly. And we're going to focus on the bariatric surgery. But when we're battling this disease of morbid obesity, we certainly don't want to overlook the importance of diet and exercise being the primary role in your long-term success with the surgery, or to undermine the importance of that in your daily life currently. But as far as the steps to get to bariatric surgery, you need to have an outstanding support staff behind you as you go along your way. And that's what we feel like we're offering here at Ascension St. John, is a bariatric program that will guide you in your journey to have long-term success after surgery. At Ascension St. John, we are certainly a large hospital with lots of resources that can support you along the way. And our program is tailored around the bariatric needs of patients and will offer you resources to maximize safety of the surgery and to maximize your success after surgery. At Ascension St. John, again, having all those resources available become very important. We have other specialists that can help us make sure that you are preoperatively tuned up for surgery, such as maybe a cardiac evaluation, being evaluated by a lung specialist. We also have, of course, in-house labs, radiology, dietitians, physical therapy. About everything you can think of is under one roof here at Ascension St. John. And that is something I think that's can be unique for what we can offer to our patients. As I was mentioning, the program aspect is very important, and you will have multiple team members behind you giving you support. We do have bariatric navigators who will help you guide the process leading up to surgery. As we'll mention, there's lots of steps to complete. And so the navigator helps you along the way, not only trying to troubleshoot some of the initial insurance issues as well. We have registered dietitians who will be meeting with you, providing you that very important education for success. And some patients use that education sometimes to even avoid surgery in the future. We just want to make sure that you have that broad knowledge of appropriate dietary habits before surgery. And they do also focus, of course, on the necessary diet you will need after surgery. So one of the strong benefits that we have here at Ascension St. John is that we do have a personal trainer on staff who works with our patients to meet their physical needs. Everyone comes from different backgrounds of what they could physically do. We try to meet you where you're at. We offer a water aerobics for a lot of patients. So joint pain or immobility issues are common among some of our patients, and we do offer water aerobics for that. But our personal trainer will work with you to overcome whatever obstacles you have to assist in your weight loss journey after surgery. We also, of course, have all the in-house resources I mentioned earlier. And during your hospital stay, we have trained nurses who are dedicated to your postoperative care on a dedicated floor who see bariatric patients routinely. So that's some of the staff that will work with you before surgery: the dietitians, the navigators, our coordinator, all there to help you leading up to surgery. Of course, during surgery, it'd be myself and my team and our OR nurses and OR staff who always get high marks from our patients as far as how well they were treated. After surgery, we'll be on a dedicated bariatric floor with nurses who are focused on our bariatric patients. And they know to help you get up out of bed quickly after surgery, take the appropriate fluid intake, and help us monitor your vital signs right after surgery. So a dedicated unit to you. And that certainly helps me as the surgeon out quite a bit to make sure that everything is going well for you post-operatively. And once we've completed our hospital stay, the support does not end there. One thing we really pride ourselves on here with the Ascension St. John program is that we do have a robust bariatric program and support system afterwards. That does start early on in your process. You will be involved with our support groups. We do offer one on Facebook, of course. We do meet in person when we possibly can. Right now, currently during this time period, we're meeting a lot outside. But we do offer lots of opportunities for patients to meet with each other, to go through this process together, because you are battling something that not everyone fully understands. And so that support system and that friendships you gather before surgery carries on after surgery. And that same team of our dietitians, our coordinators, our navigators, they're there to help you post-operatively well, troubleshoot any issues you may have. Again, there's lots of changes expected after surgery, particularly from a dietary standpoint, activity standpoint, and it's great to have that support and troubleshooting of ideas to maximize your success after surgery. So you're watching this video to determine whether or not bariatric surgery is right for you, or maybe if you're a candidate or not. As far as being a candidate or not for bariatric surgery, we do have certain criteria. It is primarily based initially kind of on your weight or your BMI, as mentioned earlier. If your BMI is greater than 35 with a medical comorbidity, we deem you a candidate for bariatric surgery. Or if your BMI is simply greater than 40, again, you may be a candidate for bariatric surgery. As far as your choice whether or not to pursue this, it's multiple factors. We view bariatric surgery as a way to restore health and functionality. We aren't really saying we're offering a cosmetic surgery by any means, and it's something that takes a lot of hard work and dedication on the patient's side. So if this is something that's interesting to you, and you meet those weight criteria, then certainly I feel like this is something you should pursue and look after. We always want to make sure there's not any medical reason for your morbid obesity. Sometimes we will check laboratory values to make sure there's no thyroid issue or adrenal issue or some other reason that's preventing you from losing weight. We do want to see documented proof that you have tried diet and exercise alone and have not been successful with that. Again, we're here to treat morbid obesity, and we are wanting to intervene to basically prevent a lot of the comorbidity complications that can be directly contributed to excess weight or morbid obesity. Some very common ones includes diabetes mellitus, hypertension, cholesterol issues, lung, heart issues, but of course also joint pain, or maybe less commonly thought of infertility issues, such as polycystic ovarian syndrome. All these things are some common medical comorbidities that can be associated with morbid obesity that we know we can intervene on through bariatric surgery. As far as other things that we're trying to accomplish is restore that health and functionality too. So as you lose the weight and your activity can improve, that is one way we can maintain that weight loss long term. In morbid obesity, again, a common issue across the country. You are not alone in this journey, and there's multiple reasons that do contribute to having issues with morbid obesity. There's environmental issues, there's economic issues, there's psychological issues, there's genetic issues. And of course, there's your own behavioral patterns that we are going to want to intervene on before surgery to make sure we can do well after surgery. But across a country, again, the statistics are not in favor of the trend of morbid obesity. The CDC has put out multiple kind of data charts indicating that we are still increasing our percentage of morbidly obese patients. And here in Oklahoma, roughly about 36% of our Oklahomans are morbidly obese. And maybe what's even more concerning is childhood obesity is still very prevalent and growing issue as well. So this isn't going away, and I think as a medical community, we do need to be more aggressive with treating this excess weight. The earlier I feel, the better. Statistically speaking, we do have information and data that proves that intervening on morbid obesity earlier essentially does prolong someone's life. And that is where surgery does play a role. Yes, it is a very aggressive way of losing weight, but as many of you are listening here have probably tried diet, you've tried exercise, you've lost the weight before, but you've gained the weight back. It's not a lack of effort. Sometimes it's a lack of structure, and I do think within our program, that is structure we're going to offer you, okay? And so as far as the surgical options out there, we do offer the sleeve gastrectomy, the Roux-en-Y gastric bypass being the two most common ones. There's other surgical options described out there. One's called the duodenal switch. And many people have probably heard of or know of someone that's had the lap band. We do not offer the lap band here at Ascension St. John. It's a very uncommon bariatric surgery. And as one of our charts here indicates, it's very basically nearly an obsolete surgery now, but we certainly here to offer support and can treat patients who've had the lap band placed, either with revisional surgeries or adjustments to your lap band if that's what you desire. The sleeve gastrectomy, though, has been growing in popularity over the last 10 to 15 years, and I think for good reason. We'll describe it shortly. The Roux-en-Y gastric bypass has classically been around for a significant longer time. It was described back in 1966, and it has declined in numbers, but that's mainly because of the popularity of the sleeve gastrectomy. So now we're going to roll into talk more about the bariatric surgery options, and we're going to focus on the laparoscopic sleeve gastrectomy and the Roux-en-Y gastric bypass. With the laparoscopic sleeve gastrectomy, it is a procedure, of course, done in a minimally invasive way, where we make small incisions on your upper belly to resect a large portion of your stomach. We say roughly about 70 to 75% of your stomach will be physically removed, and we go from a football-shaped organ to more of a banana-shaped organ. Hopefully that visual kind of gives you an idea of kind of the small, narrowed lumen of an organ you have left after we perform our resection. And that small lumen of a stomach obviously reduces the size of its capacity, so you can physically not take in as much food. But your stretch receptors get activated very quickly, and it kind of tells your brain you're full. So even a small amount of food intake goes in, you feel very full very quickly. In that sense, it's a restrictive procedure. We do see a lot of great weight loss success with it. We estimate about 60 to 70% of your excess body weight can be achieved with this surgery. And that weight loss goals come to about a year to year and a half out. So it's not overnight by any means. It takes a lot of hard work to get there, but that's what we generally expect from weight loss. It is not a reversible procedure. We are physically removing that portion of your stomach. It does not go back in. And compared to the next surgery we talk about, there's not nearly as much really absorption concerns after the sleeve gastrectomy compared to the Roux-en-Y gastric bypass. Other benefits of the sleeve gastrectomy that are less known and make it a little more complex as far as how it works. There's also neurohormonal components going on that can help promote our weight loss. One is the hormone ghrelin, which normally lives in your stomach to stimulate appetite. Since we're removing that portion of the stomach, that volume of ghrelin in your bloodstream goes down, and thus your appetite is suppressed. So not only can you take in less food and get full quickly, your appetite is suppressed. So your small amount of food intake is not as challenging of a process to take on because you are full and comfortable at this smaller amount. It's certainly there to treat all the other medical comorbidities listed before, and it is a shorter procedure compared to the Roux-en-Y gastric bypass, which has made it more favorable in patients' eyes, I believe, as to why it's become so popular. It is working just on the stomach. It's a shorter procedure. In one sense, it's a technically easier procedure to perform. Still a major surgery, still a big deal to go through for sure, but overall, we see a lot more consistent safety factors after that surgery. But because it is still a major surgery, there's going to be risk involved. Certainly there's healing concerns or what's called a leak along our surgery side of our stomach. That is very rare, but can happen. Stricture, scarring, heartburn after surgery, vitamin deficiencies, blood clots, and bleeding are all the risk factors with this surgery. I'd like to spend 1 second to talk a little bit more about acid reflux after the sleeve gastrectomy. That is definitely one process that we see that's kind of unique to the sleeve gastrectomy that even if you didn't have any reflux before surgery, it can create it. It's not the norm by any means, but some studies have indicated that up to 20-30% of patients who didn't have any reflux noticed some after this surgery. The majority of those patients we treat with medications alone, but a very small subgroup of that may even need revisional surgery to fix it. So if you have heartburn or severe reflux, regurgitation before surgery, that's something we talk one-on-one about whether or not the sleeve gastrectomy is right for you. The next surgery we'll talk about is the Roux-en-Y gastric bypass. Again, done laparoscopically or robotically in a minimally invasive way. It's been around a long time. Again, first described in 1966. I feel like we've evolved quite a bit with this surgery to make it much more safer and feasible for patients. How it works is we do create a restrictive component of it. We're kind of going from a football-shaped organ now to an egg-shaped organ by dividing the stomach up near the top of it and creating a small pouch. And this small pouch obviously creates that restrictive effect. Small amount of food goes in, you get full quickly, just kind of like I talked about with the sleeve gastrectomy. But now with the Roux-en-Y gastric bypass, we're not cutting out the stomach or physically removing. We are now rerouting your small bowel that normally leaves your stomach and bringing it up to that gastric pouch. So food enters your small pouch and then enters into your small intestine where we absorb a lot of food farther downstream. This creates our malabsorption component of the procedure. So we have restrictive and we have a malabsorption component, and thus we do expect more prominent weight loss with the Roux-en-Y gastric bypass. It is a bigger surgery compared to the sleeve gastrectomy as far as it's a longer surgery. There's more connections that are made. And so for that reason, sure, there is a little bit more theoretical surgical risk with the surgery. That being said, still low risk overall. And those risks, again, are kind of the same as a sleeve as far as there's always risks of bleeding, infection. But some nuances with the Roux-en-Y gastric bypass are ulcer formation at our hookup sites is possible, particularly if someone decides to smoke after surgery or non-compliant with some anti-inflammatory medications. So we'll be very upfront with you about what we need to avoid after surgery to prevent that, but just know that is a possibility. Obstructions or rotation of your bowel after surgery is also kind of a unique issue that can happen after Roux-en-Y gastric bypass compared to the sleeve gastrectomy. And then vitamin and mineral deficiencies, a little bit higher risk with this surgery because of the malabsorption component. Again, preoperatively, as you talk with our dietitians, we're going to get you set up with a multivitamin regimen, and thus we really should not see this if you were compliant with our medications that we are going to prescribe to you. Another unique kind of symptom with Roux-en-Y gastric bypass is called dumping syndrome, and that is basically a condition of if you take in some food that you're not supposed to, usually higher sweets, higher fatty content food, you can have flushing, feel weak, feel nauseated, sometimes have loose bowel movements, and that's called dumping syndrome. So as far as comparing these two surgeries side by side, both fantastic operations, both can have a lot of huge success. They just have their subtle pros and cons. And as far as which one's best for you, a lot of times that will come down to an individual consultation, discussion with your surgeon of what is best. And sometimes you're a candidate for either or, and that's okay. And we will have that discussion and we can make a group decision. But as far as the subtle nuances between the two, the Roux-en-Y gastric bypass technically is a longer surgery, has a little bit maybe higher surgery risk involved, but post-operatively we should see very similar complication rate as a sleeve gastrectomy. They both obviously have alterations in the anatomy. One's obviously just, again, the rerouting of the small bowel with the bypass. The sleeve gastrectomy, we are removing a large portion of your stomach. The Roux-en-Y gastric bypass does shine in a couple areas. I think this is where if you have these two conditions, we do sometimes kind of push the Roux-en-Y gastric bypass a little bit more for you. That is someone with maybe insulin-dependent diabetes and their hemoglobin A1C is still staying high. We see a lot more prominent results of treating diabetes with the Roux-en-Y gastric bypass. The sleeve is going to do a good job for a lot of people, but the Roux-en-Y gastric bypass is going to be superior in that respect. Same thing with acid reflux. Again, because of our concerns of the sleeve gastrectomy creating some acid reflux, if we have that and that is a real issue for you, or you have evidence of esophagitis or damage to your esophagus, then we would really want to maybe consider the Roux-en-Y gastric bypass for you as that surgery, because it will treat acid reflux very well itself. They both are going to require lifelong vitamin supplementation, but just have a healthy respect that Roux-en-Y gastric bypass is going to be more critical. So post-operatively, what to expect? Most patients are going to spend one night in the hospital. That's the norm. We do look at several factors. If it is safe to go home the next day, we do make sure your vital signs look good, that your laboratory values are okay, that the nursing assessment from you overnight is all being well. And we want to make sure you're able to go home and stay hydrated. So we're going to be kind of monitoring your fluid intake after surgery. So most patients go home the next day, but if any of those factors are not in line, we certainly watch you another night. As far as expected symptoms, certainly pain after surgery is expected. We do have a multimodality therapies in place to reduce your pain after surgery. Everything from nerve blocks right before surgery to, of course, some narcotic pain meds right after surgery. We do try to limit those narcotics to as little as possible, but normally a day or two of needing the stronger pain meds is needed after surgery. Some nausea can be expected, either just from the general anesthetic or from the effects of the surgery. We will certainly treat that as needed afterwards as well. And typically we go home on a list of medications to battle those symptoms that you may come up with. Dehydration is by far the number one reason people come back to the hospital after surgery. And that's why we do give you plenty of IV fluids while you're in the hospital and make sure you're able to tolerate your liquids well before going home. As far as going back to work, again, because it's done laparoscopically or robotically with our small incisions, we do expect people to be up on their feet and moving very quickly after surgery. In fact, I want you up walking up on the floor 4 hours after surgery, and our nurses will assist you with that. But as far as getting back to some of your day-to-day activities and errands, typically by the end of that first week, I expect most patients up, ambulatory, running simple errands. Certainly nothing vigorous, but they're out there functioning again in their community. And hopefully even driving by that time. As far as returning back to work, I highly recommend everyone stay off at least 2 weeks. Even though physically after that first week you might be ready to go back and get back at it, this is about you. This is a time that you need to really focus in on your health, and the big adjustment that occurs with our diet just needs to be focused on. Sometimes going right back into that work environment that might have had a negative impact on your weight to begin with is just not ideal. So I'd like for you to use those 2 weeks to really figure out your hydration status, your protein intake needs, and go back to work with resources and a mindset ready to have success at your workplace. Some patients need longer. It depends on how physically active your job is. I mean, construction workers or heavy lifting jobs might need longer. So another one-on-one conversation we'll have with a surgeon to decide what is the ideal time off for you. Well, as far as, again, we've kind of touched a little bit about your candidacy, but I want to review as far as if you feel like you're a candidate or not. We will certainly check with laboratory values whether or not there's another reason why you can't lose weight. We want to make sure you've tried diet and exercise as a first-line option to lose the weight. We want to make sure that you preoperatively have gone through our program and everything is safe. Again, that we've been cleared by our cardiologist, that we've been assessed for sleep apnea, that our family practitioner or primary care physician is on board with this surgery and supportive of it for care afterwards as well. Everyone will typically go through some sort of a GI workup, either a direct scope into the stomach called an EGD or a drink test, which I call an upper GI or swallow test to kind of evaluate for anatomy. All of this is important information as a surgeon to make sure that we're not missing something or we don't want to have any surprises during our surgery. One thing to expect before surgery is called a preoperative liquid diet. We call it a liver shrinkage diet because that's what it does. It's a very low-fat diet that's heavy in liquids to basically make your liver smaller and safer for surgery. As you saw in those diagrams earlier, I work right underneath the liver to perform the surgery. We actually use the instrument to lift it out of the way. And unfortunately, one of the disease processes of obesity is called a fatty liver, which can be an early sign of cirrhosis. And so to make sure the liver is as small and as safe as it can be, we go through a two-week preoperative diet, and our dietitians will go over that in detail with you at that time. Once we've got to this point, we've completed the program, we're understanding what we've got into, we now go through surgery, and the recovery part begins, the new life begins. And it's a lot of hard work from day one, and it really doesn't stop after surgery as well, but the rewards that we see from our patients is that they're more than willing to put the work in because they see the results. And that's what keeps us going as a bariatric team here. We see the exciting transformations that people undergo through, all the different milestones that they're able to reach, and hopefully that keeps the motivation going for you to continue to work hard for your success. So as far as the value of bariatric surgery, me as a surgeon here, I've told you about the surgery and what we're trying to treat morbid obesity. And there's no doubt that excess weight wreaks a lot of havoc on our health. This has been a very well-researched field, the field of obesity medicine. And one of the largest players that does do our research is the American Society of Metabolic and Bariatric Surgery. They're the largest non-for-profit medical society out there, and they have a lot of great information on their website for both clinicians as well as patients. And I encourage you to check out their website at the asmbs.org and see some of the information they have out there on bariatric surgery. I've compiled a few just consensus statements that they've put out on their research as to what is the value of bariatric surgery. Bariatric surgery is associated with a reduction in all-cause mortality and increased long-term survival. So basically, someone who had the surgery versus someone who didn't have the surgery, we've shown that the patients who've had bariatric surgery essentially live longer. And again, as mentioned earlier in this presentation, basically getting the surgery done earlier in life, we really do maximize those results. Sometimes doing the surgery later in life, which is very common, and so we certainly do, we see a lot more improvement in quality of life. So there's no doubt, there's never a bad time to decide to take your control of your health and make these necessary changes. But just understand when I'm talking about prolonging someone's survival or life, it's usually best at an earlier age. Bariatric surgery is the most effective therapy for morbid obesity and can result in improvement or complete resolution of those obesity complications. So again, battling diabetes, hypertension, sleep apnea, infertility problems, joint problems. These are all common medical comorbidities we know are directly improving with weight loss through bariatric surgery. Bariatric surgery is associated with a reduction of cardiovascular disease risk factors and future cardiovascular disease events. And we know that bariatric surgery is also associated with reducing the risk of certain cancers and improved cancer outcomes and mortality for women. So this is all very intriguing research that's going on when it relates to cancer. I think we'll see more and more about this in the future. But morbid obesity is directly linked to multiple different cancers out there for women and men. There's just better studies out there in the women population. Well, so, me as a bariatric surgeon, certainly I see the direct positive effects of bariatric surgery all the time. It's very rewarding for me and my team to see these transformations. We've discussed today about some of the various benefits of the surgery, but I do think that there's a lot of valuable information out there to be had, and so we have listed here a few websites that we encourage patients to look into. Very comfortable out there looking at these websites and gathering more information and bringing your questions back to our team so we can kind of clarify them for you. So in conclusion, we have described the two bariatric surgery options that we do offer here at Ascension St. John, and I have a lot of confidence that we can help you. We are a center of excellence, and that means we have a very high standard of care for our bariatric patients. We are under a lot of kind of scrutiny for our protocols, and they all do follow, of course, very nationally recognized safety measures. And all this means that it's a safer process for you and that we can optimize your success. So if you do have further questions or concerns and want to reach out to us personally, certainly our information is available, and we'd be happy to take care of you here at Ascension St. John.